Transformation Tuesday on Good Morning Washington is sponsored by Somenek+PittmanMD.
Well, according to the American Society of Plastic Surgeons, Mommy Makeover continues to be one of the most popular plastic surgery procedures performed. So today we welcome back board-certified plastic surgeon Dr. Troy Pittman with everything you need to know. Dr. Pittman, always so good to have you here.
Thank you.
So I have been, as a relatively new mom myself, talking with some other mom friends, Mommy Makeover kind of comes up in conversation. So what exactly is it?
So Mommy Makeover is really a combination of procedures, and they're really meant to address the changes that go on with a woman's body during pregnancy and then breastfeeding after that.
Okay, so it's not like a one-size-fits-all. You could maybe do kind of pieces.
Absolutely,
okay.
Absolutely. So, we kind of start from top to bottom. So with breastfeeding, obviously there are changes in the breast, some deflation of the breast, or just size changes. So part of the Mommy Makeover address either lifting the breast, reducing the breast, lifting the breast and putting in an implant to revolumize the breast. So that's kind of the top half of the Mommy Makeover.
Okay.
The bottom half is really addressing the abdominal wall changes that happen during pregnancy. So if you think about those abdominal muscles, those six-pack muscles are together, and then they split apart with pregnancy, and that little membrane in between the muscles, it stretches, and a lot of times it doesn't go back.
Yeah.
And so women will get this kind of curve to their abdomen that needs to be addressed. And so the tummy tuck addresses that. It surgically puts the muscles back together in the midline and then removes that extra skin.
And it's one of those things, especially as a mom, your body changes so much. And sometimes, afterwards you're so proud of your children, but you kind of lose maybe a little pride in yourself and your self-confidence. So who are ideal candidates for Mommy Makeovers?
Yeah, so it's really about a little bit of self-care, right?
Yeah.
But the ideal candidate is someone who has optimized diet and exercise, who really is at an ideal weight. It's really not weight loss surgery. And so they're at an ideal weight. Their children maybe are a little bit older so that they're not carrying a baby, because there is a little bit of downtime after the procedure. I think you want to almost be done with having children, particularly with a tummy tuck. Because we're doing changes to the abdominal wall, you don't want to have this surgery and then get pregnant and you kind of undo what's been done.
Okay, so there is some kind of just pre-planning in your own mind that you should. Now, you mentioned a little bit of downtime. Tell us a little bit more about that.
So I would say the real downtime is about 2 weeks of really not doing much. No heavy lifting, not really driving a lot. And then it's about a 6-week recovery as far as going back to total normal activity. Push-ups, planks, Pilates. We don't want patients doing any of that for about 6 weeks. But you're certainly not bedridden for 6 weeks.
Exactly, and you want to properly heal and kind of take us through that recovery process.
Yeah, the biggest recovery is really the first 72 hours.
Okay.
If you're doing breast surgery, you want to have little T-Rex arms. You don't want to be reaching, pushing, pulling, doing anything like that. You certainly want to have help. You want to have a lot of times we have parents, our moms, the grandparents come in and they take care of the kids, they take care of the patient. But you really want those first 72 hours to be really downtime for you. We like for patients to be walking after surgery. We don't want blood clots in the legs or anything like that. Then I don't like people lifting anything heavier than a laptop for about 3 weeks. Okay. So most children are heavier than a laptop. So no lifting kids for 3 weeks. And then, like I said, at that 6-week mark, you're back to the gym, back to doing your normal routine.
And probably feeling a whole lot better about yourself. And let's also talk about your private surgical suite that you guys have.
Yeah, we're really proud of the private surgical suite. So it's kind of like flying private entrance, private exit. You come in, we have one-on-one nursing care, so you meet your nurse in the pre-op area. That nurse is with you through the whole process, including recovery. We have physician anesthesiologists who are administering general anesthesia for a lot of our procedures, and it really is a great patient experience. It's not a busy hospital. It's not even a busy surgical center. We want to make sure that It's all about the patient. You don't see other patients when you're walking around the hallways or anything. It really feels like it's your place during your time.
It really, I mean, just looking at all of the pictures and the video, it is so welcoming and so not what you would think, you know, as if you were in like a traditional hospital or everything. And of course, you're with the absolute best. So Dr. Pittman, tell me a little bit about the reaction from patients who have had the Mommy Makeover.
Yeah, it's really a transformation. So all of the changes that happen with pregnancy, changes with breastfeeding, those are all really exciting. But at the end of the day, there's a self-confidence issue. And women look in the mirror, they see changes in their body, they're not feeling great about going to the pool and things like that. And so what we're able to give patients with kind of giving them back a little bit of youth, giving them back a little self-confidence, it's thrilling for moms. Now they can have their children, they can have, you know, their self-confidence back. So it's pretty transformational. We get great feedback.
Yeah, and I can only imagine, you know, a confident, happy mom is better with the kids and just everything. So thank you.
Absolutely.
Well, Dr. Pittman, thank you so much.
Thank you.
I feel like this is going to help so many moms out there. So for more information, visit their website. And moms, you have been just devoting your life to your kids. Now it is time to do a little something for you.
Amazing.
You know, your whole body changes, your whole life changes.
Right.
And, you know, it's one of those things, if you can do just a little something to just make yourself feel a little bit more confident. And maybe it isn't a mommy makeover. Maybe it's just going to get a facial, going to the med spa, and just doing a little bit of something for you. Be a little selfish.
Yeah, exactly. And we love them. They're just such a great, we learn so much every time Dr. Pittman's on or Dr. Somenek. It's always great.
So relatable and
Yeah.
just wonderful people.